Robafen, also known as Guaifenesin, is used to treat coughs and congestion caused by the common cold, bronchitis, and other breathing illnesses. This product is usually not used for ongoing cough from smoking or long-term breathing problems unless directed by your doctor. Guaifenesin is an expectorant, which means it works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, so do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. It's essential to ask your doctor or pharmacist for more details about using your product safely. Remember, these products do not cure or shorten the length of the common cold. To decrease the risk for side effects, carefully follow all dosage directions, and avoid giving other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier or saline nose drop/spray. When taking Robafen, you should follow your doctor's directions and take it every 4 hours. If you are self-treating, make sure to read and follow the directions on the product package. If you have any questions, ask your doctor or pharmacist for guidance. If you are taking the tablets, do not split them unless your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. If you are using the liquid form, make sure to use a special measuring device/spoon to measure the dose accurately. Do not use a household spoon. The dosage of Robafen is based on your age, medical condition, and response to treatment. It's important not to take more than 6 doses in a day and to not increase your dose or take it more often than directed by your doctor. While taking Robafen, it's important to drink plenty of fluids to help break up mucus and clear congestion. If your cough is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts, returns, or gets worse after 7 days, make sure to contact your doctor. These could be signs of a serious medical problem and you should seek medical help right away if you think you may have a serious medical issue. If you experience nausea or vomiting while taking Robafen, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using Robafen outweigh the potential risks of side effects. While serious allergic reactions to this medication are rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other unusual effects. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Always consult with your doctor about any concerns or side effects you may experience while taking Robafen. Before taking Robafen, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor, especially if you have breathing problems or conditions like diabetes or liver disease. If you have phenylketonuria, PKU, or need to restrict your intake of aspartame, be sure to consult your doctor or pharmacist before using Robafen. Additionally, if you are pregnant or breastfeeding, talk to your doctor about the risks and benefits of using this medication. And as always, before undergoing any surgery, make sure to inform your doctor about all the medications and products you are using. When taking Robafen, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be cautious about taking multiple products containing Guaifenesin to avoid taking too much of the medication. Additionally, be aware that Robafen may interfere with certain lab tests, so it's important to inform lab personnel and your doctors that you are taking this medication. If someone has taken too much Robafen and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. If your doctor has prescribed Robafen for you, it's important not to share it with others. It's important to keep all your medical and lab appointments while taking this medication. Robafen is meant for temporary use only and should not be taken for more than 7 days unless instructed by your doctor. If your condition lasts longer than 7 days, be sure to let your doctor know. If you forget to take a dose of Robafen, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Robafen, it's important to keep it at room temperature, away from light and moisture. It's best to avoid storing it in the bathroom and refrain from freezing the liquid forms of the medication. Different brands of Robafen may have different storage requirements, so it's essential to check the product package for specific instructions or ask your pharmacist for guidance. Always keep medications out of reach of children and pets. When it's time to dispose of Robafen, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.